Our next speaker today is going to be Dr. Shirley Chau from the University of British Columbia. She is an associate professor in the Faculty of Health and Social Development in the School of Social Work at UBC Okanagan campus. And she has been for many years working on the intersectionality of a lot of the issues that we're describing here today. Central to her teaching approach is that anti-racism and anti-oppression lenses, particularly for clinical and social practices, are important at the organizational and the individual level, especially in terms of accountability. She's also done a lot of work in response to the recognition of the Commission on Truth and Reconciliation and how that particular issue affects much of the oppression and challenges that we see here in Canada. So Dr. Chau, thank you so much for joining us. We appreciate you. So you're on mute. I think, did you get a prompt? Just one sec.
Thank you so much. I feel excited and to be with such a great group of people. And I want to begin with acknowledging that I'm joining everyone here from the traditional ancestral and unceded territory of the Silks Okanagan Nation. I also want to thank you, the Foundation for a Path Forward, for having me and for everyone here for sharing your thoughts, your stories, your energy to address and stop anti-Asian racism and hate. I'm going to tell you about a few things, as I only have 10 minutes here. So I'm going to tell you a few things about what I've been up to. I'm an immigrant child. I grew up in Vancouver, BC, and then I went away to Toronto to study, do my master and my PhD in social work. And during that time, I did not know at that time that I didn't know very much about my understanding of race or history in Canada in terms of race. And it wasn't until I took on my first appointment as an assistant professor at the University of British Columbia in Okanagan, which is in Kelowna, referred to as Kelowna commonly, but should be Okanagan and the Silks Nation, that it was there that I began to have a big reveal, because it was there and it was here where I am right now that my first experience was having someone come to see me to ask me about my experience of growing up in Canada and where I've been. And when I said that I've been in Toronto and in Vancouver, I was quickly told that, welcome to the rest of Canada. And I didn't understand what that meant at the time. And when the person explained it to me was that Toronto and Vancouver were really unique spaces, and that where I am now, in Kelowna, was that it was more like the rest of Canada. And what he was trying to tell me was that I was going to experience being different, which I didn't really know until I started living my life here as someone who's working here and also someone as a resident in the city. And so, long story short, I've had new experiences of racism, discrimination as a racialized woman, as a faculty member, and was getting it in various forms. And it opened my eyes to what I realized I needed to know better and learn. Because growing up in Vancouver and Toronto, while I had those experiences, I wasn't aware that racism was happening to me. And when they did, really didn't know what to do about it, nor did I have a name for it. So rolling it up to, being in Kelowna, I started observing what was happening to me. And in those earlier years of settling here, I've been here almost 20 years now, I started to make sense of what was happening, and it forced me to start looking at my research program differently. So I started looking at the experience of newcomers to Kelowna, and also including that experience to other places that are a similar size of a small city. And what I learned was that racism was definitely around, actually, a long time, and it has been around, but how we respond to it was different. And newcomers certainly had a shock in terms of experiencing racism, because oftentimes, if they came from a place where they're a member of the majority, they would not have experienced discrimination based on race so much as it is maybe on shadism or on class or gender or disability, but not necessarily on racism in the way we know it in Canada. And so that led me to really pay attention, because I was also training up and coming social workers to become clinicians who would be effective in their work. And because race was an issue that was something that didn't get talked about here very much and still doesn't very much, I felt that I had to address this in terms of my teaching. And it was through all of this work that I started to realize something, and that newcomers were experiencing racism and being racialized, and yet the service providers that they were working with wasn't able to support them in their settlement work in the way that they wanted to, because they didn't know what to do with this. And part of the problem was that even though the service providers were hearing stories, they felt that their hands were tied because they didn't know what to do, because their experience themselves were that when they've shared stories of racism and harms done to people, it wasn't believed, especially in a place like beautiful Kelowna, considered to be a tourist destination. And so when it's not believed, people after a while stop talking about it, and they learn to silence themselves, because it's actually quite painful to share something painful and to not be received in that way, or be considered as telling the truth. And so that led to my work with some of the service providers to develop a tool for them to learn how to ask these things in a way that was in a systematic manner, so that we could start collecting information. Because when the local police and other systems who are in the position to help was not making it easy for people to actually move forward to get help, actual help, to actually stop the racism and to get some healing and to have restoration of wellness. The problem was there wasn't enough evidence. And so in 2019, I started working with people to develop this tool so that they could start collecting these reports. And by 2020, we had turned it into an online portal. Lo and behold, at that time, we didn't know that the pandemic was coming. And so when it did, we started seeing reports of racism. But interestingly enough, I'm still collecting those reports. Over 2020 and 2021, we didn't actually see actual reports on anti-Asian racism per se, though we saw reports of other types of racism. So I started wondering why that was the case, and started asking questions as to what is happening here. And I started to learn that among the Chinese or Asian community, not necessarily Chinese, but Asian community, there was an idea that they didn't want to talk about it because they felt that it would be shameful to talk about it, that it was their fault for having that. And so we're familiar with that. But we also know that there were other things that were going on too, in terms of people felt guilt that if they were to speak against to people about their experience, that they felt they were speaking against Canada, not realizing that Canada, we actually have a social consciousness about this. And so there's some education that we need to do more of it. But more importantly, though, for those who have reported and have had harms done to them, not once, but repeatedly as part of their everyday experience, what they're asking for is, we need a legal system that actually has teeth, where we can actually stop the harm. And that when people do make these complaints, that they are not the ones being interrogated and being re-victimized, as well as also for witnesses who step forward, that when they also talk about having seen something, that they're not to be shunned, that they're to be believed when they've seen something, so that you don't shut this down. So we know silence and isolation are ways to keep these things from making any appearance, and for it to be addressed. So that's part of the work that's been happening, and it's spreading out in other places as well to help people get a handle on what's happening. The other piece of work I'll quickly tell you about is that, related to this work of learning to develop a reporting system and being able to use that information to help service providers develop capacity to address the harms that have been done, at least on an individual level, and then bringing it up to the governments to let them know that here's a number of cases we've got to do something about this. I'm also the co-chair of the UBC President's Task Force on Anti-Racism and Inclusive Excellence, which we just launched the report in April 22nd, 2022, which was just a couple of weeks ago, a month ago. And I'll share the link here. And in that process, we had the task force. The president wanted the task force because of all the things that others have been talking about, which were these the rise in anti-Black, anti-Indigenous, anti-Asian, anti-Muslim, anti-Semitic, like all of these pieces. And so the task force came together to do this work, and we generated a almost 300-page report. And that was done with faculty, staff, and students to understand their experience of discrimination, racism, and hate at UBC, both campuses. I've shared this report so that you can see these reports. You can read them as a full report or 6 separate reports based on different groups or constituencies. What I learned, I can tell you, is that there's a similarity here between what I saw in the community in Kelowna in terms of understanding experiences of discrimination and hate. And what I saw also in this task force was that the complaint system doesn't work. And we need a really good system that helps people actually get care and services when they need it, at the time that they need it. And so right now we're waiting for the university to do the work they need to do to implement the recommendations. But the recommendations that we've developed at the university came out of lived experience. They're not theoretical. And they come from an intersectional perspective to try to also address many of these issues. Recommendation number 49 is specifically on anti-Asian racism and how we need to stop that at the university. Recognizing that what happens in people's experiences on campus also happens and affects them in the community where they live their lives. And so I'll end with that because my bell just started, but happy to connect with others as we move along. And thank you so much for your time.
Thank you, Shirley. And I love how you had a prompt at the end of 10 minutes. That is so awesome. I'm going to make sure that we do that as well for future events. It's very professional. Again, the unique situation of being in real Canada, quote unquote, and understanding the psychology of people there, particularly how it affects the lived experiences of communities, is something that we on the coasts don't necessarily always understand, whether in Toronto or here in Vancouver. I'll give you a quick example of that. I was doing a cross-country trip with my wife, and we were passing a small town in Alberta, and the local car wash there was named the Triple K Car Wash. And I thought to myself, I was like, I hope that doesn't mean anything. But we know from evidence that there is a lot of white supremacist tendencies, let's put it that way, in a lot of rural parts. And I think separating that from white people is something that everyone on this call understands and is happy to do. But that experience that you're talking about, the self-silencing because of an oppressive environment, those kind of examples illustrate how that can be continuously a buildup for people when they see stores named that, when they see people looking at them, or they see comments or hear comments directed at them or around them, being a case in a lot of rural areas. So again, thank you for highlighting the role that education has to play, what you've been doing, and the work of universities in trying to counter this narrative with education and understanding, particularly in rural areas where many great people live. And there is a challenge, though, that has to be addressed there, as within, unfortunately, many parts of Canada. But thank you, and look forward to seeing you tomorrow. So for the Anti-Racism Roadshow. So thank you so much, Shirley.